Look at life expectancy and how it changed between 2019, before the pandemic, and 2020, of course, the worst of the initial surge. New York City Health Department identified two key factors here. Of course, COVID, but also overdose deaths, which were exacerbated by the pandemic.
There are clear inequalities, clear disparities in how this disease is affecting the people of our city.
It was a month into the pandemic, April 8th, 2020, when former Mayor Bill de Blasio said preliminary city data was beginning to show what most suspected, that the COVID-19 pandemic was taking the greatest toll on communities of color. Now, a new report almost exactly 3 years later lays out the devastating impact. The City Health Department reports that between 2019 and 2020, life expectancy of all New Yorkers fell to 78 years old, down 4.6 years. But specifically, the African American community life expectancy dropped to 73, down 5.5 years. And the Latino community dropped 6 years to around 77 years old.
It's a staggering loss of life that we're looking at.
Dr. Mark Gurevich is the chair of population health at NYU Langone. Gurevich says from vaccine equity and combating misinformation to addressing big structural barriers like income and education inequality, this report only underscores the need to focus on these issues.
A moment like this and a pandemic like this brings into sharp relief just how fundamentally important they are.
The report from the City Health Department says overdose deaths also rose significantly from 2019 to 2020 by 42.2%. As we've reported, a lot of resources locally and nationally are being poured into this problem. Still, Gurevich says the overdose crisis may hold back a life expectancy bounce back that he does anticipate.
So I can't predict what 2021 will look like, but I certainly expect that in 2022 and 3, we will begin to see a real uptick as the immediate cause, which is COVID and deaths from COVID, lift.
And Dr. Gurevich tells me that he does not expect this to impact the labor force because, as we know, unfortunately, most of the lives lost in the pandemic affected older New Yorkers and New Yorkers who were retired.